Here's an example of why you want to think twice about getting a full arch implant acrylic prosthetic. Hi there, I'm Dr. Gregory Broyde from Smile Now. Today, I want to go through a patient that came to our office. She had a full upper fixed and lower done 8 years ago, and she had it done with acrylic. She came to our office with a complication. This case is a perfect example of what I talk to my patients about on a daily basis. Acrylic has inherent flaws. It's something that we no longer recommend to our patients as a material of choice. The issues with acrylic that we talk about again and again is that it's weak, so it tends to chip or break, and it's porous, so you tend to get bacteria stuck to the side of it. So this case perfectly explains why we don't recommend this for our patients anymore. Now, what you'll see on this photo is you'll see what we commonly do. We call this a wraparound fixed hybrid, but it's a titanium core, and then on top of that bar, we place acrylic. And this is a perfect example. So she came in with a chipped fixed hybrid. Now, the good news is that the implants are still in okay shape. It's only been 8 years, but this is already a complication that's not that easy to fix and takes multiple appointments. So looking at the next screen, what you're gonna notice is a couple of things. First of all, there's good reduction. There's a lot of room for material. So this really shouldn't have broken. It's over 12 millimeters, number one. Number two, you can clearly see the titanium post and the cement that we use to hold it all in. But probably most importantly, I wanna show you a couple other things. First of all, look at the staining. Okay, this porosity, the holes, the micro holes inside the acrylic, just allows for bacteria to get stuck to the prosthetic. This is a problem, both in terms of smell, but also in terms of look. And probably the most important of all, back to porosity. At that ledge where the tissue meets the prosthetic, look at the bacteria, all this bacteria. She was telling me that she was getting this removed every year and cleaned. And even after that grade of maintenance, she's still having problems. Look at the gums underneath the acrylic. Look at how red and inflamed it is. This is going to lead to implant problems on the road. This is a perfect example of what we talk to our patients about. Some office is going to tell you do this. It's less expensive than zirconia. But she's only 8 years in, she's already having these issues. There's a very high chance that this prosthetic won't get to year 15, year 20. She's likely to get bone loss. She's likely to have more complications like this. These problems are inevitable and inherent with acrylic. If this patient got zirconia, this entire piece would be one material. The chances of it breaking are practically zero. It would be smooth, so bacteria wouldn't get stuck to the edge. It wouldn't stain, it wouldn't wear. All these problems would not exist if this patient got zirconia. Now, 8 years ago, zirconia technology was nowhere where it is today. We didn't have the milling, we didn't have the materials, we didn't have the aesthetics. But now, this zirconia would be much more aesthetic and translucent than this would be. And these breakages just wouldn't happen. So in a modern era, you really want to consider zirconia as your best option because yes, it's slightly more expensive day one, but over the span of 25 years, it's going to be considerably less expensive.